Good morning, Daktari, and welcome to today's edition. We are celebrating World Mental Health Awareness Month 2025. We are privileged that you could join us in this podcast today to shed more light on what KUTRRH, Kenyatta University Teaching, Referral and Research Hospital, is doing during this month. Kindly start by introducing yourself and tell us a little bit more about this department.
Thank you, Christine, and good morning to you too. So I'm Dr. Muia Janet. I'm a consultant psychiatrist at Kenyatta University Teaching, Referral and Research Hospital. We are big on changing the world one mind at a time. So we have a mental health department at the hospital that offers both outpatient and inpatient. For outpatient, we run outpatient psychiatry clinic, which is a specialized clinic, sees people of all ages, children, the youth, and even the elderly with the various mental health conditions. We also run an outpatient for mental state assessment for those requiring GAN. As you know, it's a requirement by the law. For the psychotherapy clinics, we offer individual psychotherapy. We offer family and couple psychotherapy in the hospital. For the inpatient, we are big on offering comprehensive care. So we partner with the various departments in seeing the patients, either medical or surgical, who might need mental health support. So we do that as well. And we are also big on community outreaches so that we keep raising the awareness on mental health and reaching out to the patients wherever they are.
Lately, mental health has become quite a big issue in our society.
Yeah.
So what should the public generally take away?
So part of the reason why we are having the World Mental Health Awareness Month, which is celebrated annually every year in the month of May, is to offer a month where people are having open conversations about mental health, where we are very intentional in creating awareness on mental health and mental well-being, in being advocates, in aiming to reduce the stigma that surrounds mental health and mental health disorders, and also providing an opportunity to provide support for those who are living with mental illnesses. So it's more of breaking stigma, allowing each individual to be very intentional about their own. It's a season where you reflect on your own mental health. And if you need help, you're able to seek help. And as we're doing awareness, we are also mobilizing people to know where to get help, the resources available in the country, both in private and public hospitals. And also the conversation also is at the policy levels, where we are seeking to raise more funding and increasing the budget for mental health and raising policies that are of positive impact on mental health. Yeah.
Great. Kindly shed more light on what are some of the challenges you may have encountered about the mental health misconceptions.
Okay.
Yeah.
Like you rightly put it, there's quite a bit of myths and misconceptions surrounding mental health. One coming from our various cultures and the level of knowledge in regards to mental health. So there are quite many. I'll probably discuss a few. But one is, when you hear mental health, most people think mental health disorders, and you're thinking it's for certain people. It has nothing to do with me as an individual. But just knowing that mental health is your everyday health. There is no health without mental health. It's beyond just the lack of disease. Probably if I give us a better understanding of its definition, so that we realize it's our everyday thing, our everyday priority. So when you look at the World Health Organization definition, it talks of it's a state in which an individual is able to realize their abilities, is able to cope with the stresses of life, is able to remain productive in whatever it is they do, and make a contribution in the community. These are things we seek to achieve every day, and we can only achieve them at optimum if we're in good mental health. So it's for everyone. It's not for a certain people. Okay. Another big misconception is if an individual has mental illness, it's a sign of weakness. So mental illness can affect anyone, irrespective of age, gender, race, socioeconomic status. It has nothing to do with a character flaw or a side of weakness. I get to hear patients being told when they're struggling with depression, be strong, stop being weak, which is really wrong. Like mental illness, like any illness, is caused by a myriad of factors. We don't tell someone who has malaria to be strong, like they are weak. The same way someone with mental illness has nothing to do with the level of their strength or weakness, as you may, or a character flaw. So that's a major misconception. Another big one is that the only form of treatment is medication. So you told if you go to a psychiatrist, they'll put you on this medication that you'll become dependent on, and which will cause this side effect, which will make you a shadow of who you are. That is far from the truth. So there's quite many forms of treatment or management, which is patient-centered. So depending on what an individual has, there are patients we don't even use medication. We are able to manage on psychotherapy alone, or lifestyle change by you being active and being interactive, and you are able to sort the mental health issues. Some we use both medication and psychotherapy. So it is not always that we give medication. The other thing is we are using medication because you need it. You have the symptoms.
Yeah.
And most of the mental health medicine, they work on the neurotransmitters, which are the chemical in the body. And when you have mental illness is when there is an imbalance. So the medication are seeking to correct that imbalance. So they are helping you rather than you becoming dependent on it. And then we have moved as a field of psychiatry. We now have medication where you won't become stiff, you won't drool. You will be on medication and not the next person next to you can't tell if you're on any psychiatric medication. So we shouldn't be afraid to seek care because we are afraid of the medication or being dependent on it. And then a last big one is the thinking that once you have a diagnosis of mental illness, there is no hope, there is no future, this is long term, and you can't be the person you are to be. And the truth is, with early intervention, consistent treatment, self-awareness, self-acceptance, and a good social support, we've seen patients with mental illness, even severe forms of it, being able to thrive in their careers, finish university, and achieve whatever it is they would have achieved if they didn't even have mental illness. So it is not all gloom. It's not all bleak. There's hope. There's future. Yeah.
Awesome.
Someone shouldn't feel lost. Yes.
All right. How has the conversation around mental health evolved in recent years, especially post-pandemic?
Interesting question. I'd probably look at it in twofold. The positive impact in the mental health space after COVID, and also the negative effect, because it goes both ways. On the positive aspect, the pandemic accelerated the uptake of telepsychiatric, the digital psychiatrist. We got into a space we realized mental health services can be offered virtually. Before it had to be in person, but now psychiatrists, psychologists, counselors are now open to offering virtual in the various platforms, mental health care, which now opens the scope to people who previously couldn't get help are able to get help through the virtual and the digital platforms. Also, the pandemic made a lot of us very aware of mental health and its effects. So the conversation became more in all medias. And also individuals became more intentional. You remember during the pandemic, we had estate or community walks and runs and Zumbas and gym. It's continued even up to now. So we have groups in the community taking up the responsibility and being very intentional about their mental health. Also the resilience level, our ability to bounce back, the fact that we were able to live through the pandemic as individuals, as a society, has made us much more resilient, and which is a good trait, which will allow us deal with things in the future. And also at policy level, we are seeing more policies that are more aligned towards supporting mental health. Just a case in example, the Ministry of Health was able to launch the national guidelines on mental wellness in the workplace, which is now allowing individuals, both in public and private institutions, to make policies and programs that empower the mental health of their employees. On the flip side, we have individuals who are still struggling with the sequel of the pandemic. We have individuals who are struggling with post-traumatic stress disorder, especially the frontline workers who are at the forefront of seeing the effect and the multiple deaths. We have individuals who are still struggling with anxiety. We've seen individuals who've had to retire on medical grounds because they're unable to enter an hospital because of the anxiety and the fear they got as a result of what happened in the pandemic. Individuals who are still struggling with depression from the effect, either they lost their job, the financial impact, the isolation, and quarantine, they have never been able to bounce back. So there are still people many years down the line who are still struggling with complications of mental health post-pandemic. But we've had quite positive leaps and bounds from it.
Okay.
Yeah.
So what are the most common challenges of mental health that people are facing currently?
So it's a whole spectrum. Yes. I would start with people are struggling with burnout. These are not mental health diagnoses or illnesses, but they are mental health challenges. Burnout, where you're unable to meet your goals and expectation. You're constantly fatigued. We keep talking of stress. Yeah, it's part of life. It's omnipresent. But when it becomes at the point of distress, it's significant. And looking at the economy, looking at the times we're living at, a lot of individuals are struggling with this. There's a lot of breaking relations. We know we are social beings. So the conflicts, the disintegration and the dysfunction in the family setup has a direct effect in the mental health of all involved, including children. And then now moving into the disorders, there's anxiety, where individuals have constant worry, constant fear, which affects their occupational, social, and functioning. We have depression, which has been quite a conversation. Which is a mood disorder where individuals now are persistently sad. They are low energy, low appetite, struggling with sleep patterns, negative thoughts, leading to even suicidal thoughts and even some attempt suicide. And mood disorders, the bipolar mood disorder, where people have extremes of mood. Another big one is the various forms of addiction. On alcohol, substances, the cannabis, social media, and then other big one, gambling. Yes, which has become quite a major issue. All these are mental health issues because they are use disorders. You get to a space where you no longer have control and you keep at it even when it has direct effect on your health and social being. Yes, that's just quite a bit of what we deal with and the community is dealing with. Yes.
So how does mental health affect our physical health, our relationships and productivity in our day-to-day lives?
Yeah. Like you recall on the definition, it's essentially mental health affects how you think, how you act, how you behave, and you feel it. So there is a direct interplay between physical health and mental health, in the sense that our mental health will affect our physical health. Because when you have a mental health issue, it affects your appetite, your physical activity, your sleep, which affect your physical health. Okay. And in terms of physical health, especially individuals with chronic illnesses, terminal illnesses, where they are thinking of life and death situation and the financial bit that comes with chronic illness, it directly affects their mental health. So it's a two-way interplay relationship. And we find patients with mental health issues are at a higher risk of physical illnesses, the lifestyle and the cardiovascular diseases, and also people with chronic illnesses are at a high risk of mental health conditions. So it affects both ways. On the bit of relationships, certain mental illnesses, some of the symptoms are social isolation and withdrawal that directly affects the relationship, the emotional ability. You're not able to control the emotions, so it affects the people around you. And as we are having this conversation, there are people we rarely look at who are the caregivers of people living with mental illness. There is caregiver fatigue, because if you are a caregiver of someone who has a chronic mental illness, it takes a toll on you, and also the stigma that surrounds it. It affects the patient and their family and the people around. So this affects relations and all that.
Some statistics on mental health, has it increased or decreased in recent years? What are the contributing factors, Doc?
The data and research on mental health and mental health issues is happening, but we are not yet there. So we might not have the exact figures on quite a bit. But just an example, a research done in a hospital setting, not a psychiatric unit, found 25% of those in the outpatient who had come to hospital for other reasons had mental illness, and 40% of those in the inpatient admitted for other reasons had mental health illness. This translates to about 1 in 4 Kenyans have mental health issues. The numbers could be higher. And even looking at the global picture, like suicide contributes to the 4th highest cause of mortalities, of deaths, for those between the age of 15 to 29. That is quite a significant number. And mental illness and mental health issues are not caused by one factor. It's an interplay of a lot of factors, the biological, where we are looking at the genetic predisposition. A family history of mental illness will make an individual in the same family at a higher risk of the same. We have psychological factors, we have social and environmental. So all these factors affect or contribute to one eventually getting mental illness. So it's an interplay of all this. So you find that our financial state, our emotional state, the environment we are in, the spiritual state for those who are spiritual beings, affects who we are and our mental well-being, and eventually either can be protective or predispose us to mental illnesses.
Is it safe to say that mental health is hereditary?
Yes and no, in the sense that when an individual has a family history of mental illness, they're at a higher risk. But not everyone in that family will get mental illness. So the fact that you have a family history alone is not the reason you'll get mental illness. The other factors have to come in play. Probably you've had advanced childhood traumas, you are struggling financially, you have social conflict, you are in a toxic environment at the time. So together with you having a family increases your risk. So it is not one factor leading to, it is more of an interplay with these other factors, and then family history is one of them.
So what's a possible solution to the growing challenge,
Mhm.
both locally and globally?
Okay. So when we are looking at the solutions, it's important for us to look at it from all levels, as an individual,
Mhm.
as a family, as a community, and at policy level, because all these factors will guide the picture of mental health, and also look at it from the point of, are we preventing mental illness? Are we promoting your mental well-being? And are we curing and offering support for already those with mental illness? So at individual level, you look at the basic things. How intentional are you as an individual on your own mental health? Do you have a self-care routine? We say you are what you repeatedly do. So do you exercise? I'm not even talking of gym membership. Are you able to take walks at least 5 days a week? How's your sleep pattern? Are you getting restful sleep? Are you having healthy, balanced diet? Are you doing what you love? Are you connected socially with your peers, with your friends, with your family? So at individual level, these are things we can do to promote, to prevent mental health issues. At family level, how's the family environment? How are we solving conflict in the family? How are we there for each other? How are we supporting each other? For the families with individuals with mental illness, how embracing, how are we providing psychosocial support? How caring are we to them? At community level, are we looking at providing a community that is very aware of mental health issues, where we have open conversation even in barazas, in churches, in institutions, so that we have more people aware and the stigma is reduced? Are we embracing individuals who have mental illness? Are we willing to offer jobs for them? Are we able to integrate them back into the society and make it not be them, but us as one community? Because this directly affects the mental health and mental well-being of the area. Are we able to even have support groups like the one for Alcoholic Anonymous in every single community? Because the truth is, we have people struggling with substances, we have people struggling with alcohol. Rather than seclude them, provide avenues where they can get support, vocational training, so that they have recovery capital to change their outcome. At policy level is, are we having the conversations in the rooms that matter? Are we prioritizing policies in regard to mental health? We now have the bill on decriminalization of suicide in Parliament. Are we ready to make it happen? Are we increasing budget and financing for mental health at all levels? So it's a whole ballgame that's still locally and even globally. Yeah. Every individual, every institution, every government has to make it a priority and take action to make it happen.
Have we made this accessible to patients needing the treatment, the necessary treatment?
Yes.
And especially seeing now with the SHA incorporation, how accessible is it for patients to get this very much needed treatment?
I would say we've made, as a country, we've made really major strides in terms of mental health care at all levels, from level 1 all the way to level 6. So yes, there is care in the various levels, but it varies in terms of specialization. And also, like I said, we now have options for telepsychiatry. So even an individual who is at level 1 and level 2, they're able to make a consult at higher level and get a patient to get care, link them and refer them appropriately. We also have free helplines for individuals who are struggling with mental illness. So you're able to reach out either for suicide, or you just need a listening ear. That is available now as a country, as an idea by the Directorate of Mental Health in the Ministry of Health. So we have moved far, and yes, mental health services are covered in the SHA, the social health insurance. Yes, even in our hospital, you're able to get consultation and care. for the mental health issues using SHA as a form of payment. Yes, so it is available. And we are doing better. We're not where we should be, but we would say we've really made major strides. Yes.
Okay.
Yeah, and the future can only be better. I would say yes.
Awesome.
Yeah.
Here at Kenyatta University Teaching and Referral Hospital,
yes,
what strides have we made in getting to where we are as a mental health department?
We are growing. Initially, we didn't have the patient numbers, but right now we are quite seeing a lot of patients booking our services, and also it stems from individuals are now more aware. They don't essentially wait until they're unwell. I've seen patients walk in and they're like, I'm not so sure I need to see you, but why don't we have a conversation and see how it goes? So the empowerment that you don't need to wait to have a disease or illnesses to seek help. So we are getting a lot of patients who are just coming in just to have an evaluation of their mental health and well-being and to get counseling or care where it's needed. So the patient numbers has increased and the scope of the variety of patients we see has also widened. I'm seeing more of children also coming in, children with autism spectrum, yes, ADHD, the attention deficit hyperactive disorder. So we are seeing them coming in, and the beauty is we have a fully equipped occupational therapy department, which is able to offer support to the children with the neurodevelopmental disorders. So that has changed or is growing. So we are open to see patients, whether you feel you're unwell or not. Just being very proactive and very reflective of your own mental health and seeking help for it. Yes.
Okay.
Yeah.
Is it safe to say that mental health disorder is only found among the adults, or do the children also suffer from mental health disorder?
Mental health affects literally everyone.
Oh,
yes, from children. Like I said, the neurodevelopmental disorders are during the developmental period. So yes, we get to see children as young as 2 years or even, who are starting to show probably delayed speech and you're wondering what is happening, or a child is hyperactive and you're wondering what is happening, or a child has not achieved the milestones and you're wondering what the issue is. So we see the children, we see the young people. It's interesting to know most mental health disorders have their start at the youth period, the teenage, around 15, moving to the 20s. So we get to see that, and the middle age, the old age, we have dementia. Yes, and so it spans. Mental health affects everyone. Mental health disorders rather affects everyone, irrespective of age, gender, socioeconomic status, and race. So there is no certain population where you say they are more affected than others. Yes.
Okay. Doc?
Yes.
Please give us a parting shot.
Okay.
Yeah.
As we have the mental health month in May, my appeal is for us to have more open conversation, for us to reflect on our own mental health and be intentional about it as individuals, as community. We'll be more accepting and more receptive of those with living with mental illness and offer them the needed psychosocial support. And it's okay not to be okay. We need to be okay so that we can build the nation and be productive. Yes, and at Kenyatta University Teaching and Referral Hospital, we do have a mental health unit. We do have mental health services. Yeah, you need to reach out and book an appointment so that we are able to offer you a patient-centered care, which is comprehensive at the different levels, preventive, promotive, and even curative for those already who are unwell.